Welcome. I'm Dr. Robin Berzin, and this is Creating Mental Wellness. In this course, we are going to learn how to generate a higher baseline of mental health and happiness. We're going to learn about the science, the biology, the physiology, and the daily practices and core actions you can take to achieve greater mental wellness in your everyday life. Let's start with the truth about mental health. We are told in our culture that mental health is an issue that only some people have. It's a rare condition and it's a moral failing to have anything going on in your mental and emotional state. But the statistics say something completely different. 1 in 5 people experiences anxiety. 1 in 12 is diagnosed with depression. 90% of our workforce has experienced burnout. As many as 1 in 3 U.S. students has experienced anxiety or depression. And today, 1 in 10 children is diagnosed with ADHD. Well, what about you and me? Even if we don't carry a diagnosis, every single one of us struggles with mental health sometimes. And the reality is we aren't taught the tools or skills or concrete actions to take to have better mental health, because being normal, whatever that even means, is just considered a given. But what if today's conditions for our physical health and our mental health are anything but normal? And what if we need tools and skills to generate better mental wellness, just the way we learn to tie our shoes and brush our teeth to get through the world? Now, today I'm a mom, I'm a doctor, I'm a CEO of a successful healthcare company called Parsley Health, where we find and treat the root causes of today's top conditions and symptoms, and we deliver care nationwide. And I have a lot of tools. I have a lot of tools to address the mental and emotional stressors that I face daily as somebody living in the modern world. But I didn't always have these tools, and when I graduated from college, I felt anxious, I felt stressed, I felt lost. I thought I was healthy, or I didn't even really know what that meant, and my definition of health was pretty lacking. I subsisted on coffee, apples, protein bars, grilled chicken, and alcohol because I was out partying a lot. And I ran on a treadmill 4 times a week because my idea of being fit meant fitting into a size small. I routinely had brain fogs, headaches, mood swings, and sort of lived in a permanent hangover-like state. And my sense of exhaustion was something I was way too young in my early 20s to have. But I assumed it was just me, and when I looked around me, everyone was dealing with this in some way, shape, or form. One day, I got out of work early and I found my way to a tiny little yoga studio downtown in New York, walked my way up the stairs and said, hey, I'll give this a try. I wasn't someone who grew up with yoga, with meditation, with spirituality, or with any of these types of practices. So I'll be honest with you, it was all a little strange to me. But I found after my first practice, something pretty profound happened. As I walked down the stairs of the studio feeling shaky and much more tired than I thought I was going to from something that I had ruled as easy, like a yoga class, I found that I had slowed down. I felt present, I felt calm, I felt more aware of my body and space. I felt relaxed, I felt content, maybe for the first time, at least the first time in a long time. And I realized that my actual and metaphorical treadmill, the one I'd been living on in all the ways, wasn't working. That moment led me to more yoga classes, certainly, and those put me on a new path. Yoga led me to changing my entire life. I changed my diet and started to understand that food could deeply impact how good or bad I felt, and I began eating to feel good, not just to look good. I even became interested in health and medicine and the connection between the mind and the body, and I quit my legal job and ultimately went to medical school because I wanted to have a strong foundation in medicine and biology and psychology and all of the fields that I was beginning to get interested in but frankly didn't know very much about. I made my way to medical school in New York at Columbia College of Physicians and Surgeons and ultimately to internal medicine training at Mount Sinai Hospital, also in New York. And my medical training revealed something to me that I didn't fully expect. I knew that I would learn all the fields of medicine, from surgery to internal medicine and primary care to psychology to obstetrics and gynecology. I thought I would get the view of everything. But what I didn't expect was how separate some of these departments were and how deeply we had separated the mental and the physical in our medical field. In the primary care offices where we would see patients, we would refer to psychology anytime there was a mental health issue, as if we as internal medicine physicians didn't have anything to offer besides a diagnosis. And what I saw over and over again was that wait times for therapy and psychiatric evaluation could be weeks, if not months. I wasn't ever taught to consider that conditions like heart disease and diabetes and blood sugar imbalances, hormone conditions and inflammatory diseases were connected in any way to the mind or the state of mental health. I also certainly wasn't taught about the impact of food or movement or stress on mental health outside of learning to diagnose substance use disorders like alcoholism. I learned so much in my medical training at Columbia and Mount Sinai, and I'm so fortunate for that foundational training. I was also ultimately lucky enough to train in root cause resolution medicine, which is a way of thinking about the body as an ecosystem. The mind and the body are not separate. We are not a set of organs and jars lined up next to each other with the heart over here and the brain over here and the gut over there. No, we are one system, and that system extends to our environment and our food and the way we move and everything around us. In root cause medicine, we learn to use that wider data set as inputs to understand that maybe that brain fog you're experiencing could be starting in your gut. Maybe that skin rash you have could be linked to your hormones. And what I also learned in understanding root cause medicine was that so many patients who are experiencing either a mental health diagnosis or condition or just a common low baseline of mental wellness were actually dealing with issues that were starting in the physical body. I started Parsley Health to treat the root cause of heart health, of blood sugar conditions, of infertility and hormone imbalances, of migraine headaches and autoimmune diseases and GI conditions, and to treat the root cause of some of the mental health disorders and low mental well-being that I saw every single day in my practice. In fact, it's interesting, at Parsley Health, we've seen tens of thousands of patients, and 1 in 5 come with their primary concern being a mental health condition, even though we are not psychologists or psychiatrists. Day in and day out, we treat anxiety and depression, chronic fatigue, insomnia, fibromyalgia, and burnout. And if it's not the first diagnosis that they're coming for, it's the most common second one. I'm really proud to say that our data shows that through our work of diagnosing and treating the root cause, we're able to help people reduce the number of psychiatric medications that they're on by 25%. And we're able to reduce the chronic prescription drug burden across the board by 65 to 75% by helping people heal. What's even more exciting about this course is that I'm going to take all of that knowledge from medical training, internal medicine, root cause medicine, what we've learned through tens of thousands of patients in our practice, and show you how to implement some of these tools and changes in your life in a way that you can use every single day. But before we get into solutions, what I know is this. Feeling anxious, tired, burned out, sad, unable to focus, all of these symptoms should not be the new normal. And yet for too many of us, it is. The good news is there's a lot we can do about it. The tools, practices, and principles that are going to elevate your baseline of emotional well-being are going to use your new understanding of your body's own biochemistry and physiology to reset your mental patterns from the inside out. We all experience challenges and stressors every single day that will rock even the steadiest mental health and well-being. Many of us are suffering from mental illness that's based in trauma or genetics or life experiences that we did not choose, but that we are forced to face. Regardless of where you're starting from, all of us can get better and feel better, and I'm excited to teach you how.